Blood is supposed to save lives, but in this hospital, it became the weapon that killed them. A simple red label, a wrong name, and people who walked into hospital alive never walked out. This is Blood Crimes, Episode 2. In the early 2000s, North Staffordshire Hospital in the United Kingdom was just like any other government hospital. Busy wards, overworked nurses, doctors rushing from patient to patient, and hundreds of blood transfusions being given every week. Nothing seemed unusual until patients started dying. Not from their disease, not from surgery, but from the blood meant to save them. One patient had a routine operation. Another needed blood after bleeding. A third was recovering well. Until suddenly, everything went wrong. Within minutes of receiving blood, they developed fever, chest pain, shortness of breath, dark urine, sudden collapse. Some went into shock. Some went into kidney failure. Some never woke up again. Doctors were confused. They had done everything right, or so they thought. The truth was terrifyingly simple. Patients were seeing given blood that did not belong to them. Blood bags were labeled incorrectly, collected for the wrong patient, given to the wrong person at the bedside. In some cases, 2 patients were swapped. In others, blood meant for one ward ended up in another, and nobody noticed. Let me explain what happens medically. If someone with Group A blood receives Group B blood, their immune system attacks those red cells. This causes massive destruction of red blood cells, release of hemoglobin into the blood, kidney failure, shock, clotting problems, death. This is called an acute hemolytic transfusion reaction, and it is one of the most violent reactions the human body can experience. It can kill within minutes. After several deaths, the UK government launched an official investigation. What they found was horrifying. Staff were skipping patient identity checks, not comparing wristbands, not matching blood group labels, not following transfusion protocols. In some cases, nurses assumed someone else must have checked. They didn't. Even worse, some of these deaths were not immediately reported as transfusion errors. They were written off as heart failure, surgical complications, infection. It took families demanding answers for the truth to come out. Their loved ones did not die from illness. They were given the wrong blood. The scandal shocked the UK. Hospitals were forced to change how blood was handled. New laws were made. Barcode scanning, electronic blood tracking, strict identity verification, mandatory double-checking. All because people died from something completely preventable. Final message. Blood is powerful. It can save a life, or it can end one. Not because blood is dangerous, but because humans make mistakes. And when systems are careless, those mistakes become deadly. This was Blood Crimes, Episode 2. And this is why every drop of blood must be treated like a loaded gun.